Hi, welcome to How to Avoid Gum Disease, Dentures, and Root Canals. I'm Christy in marketing with VCU Health Community Memorial Hospital, and it is my pleasure to introduce Dr. Al-Oweidi, who is our new dentist. He is also known as Dr. A among his colleagues and patients. He earned his Doctor of Dental Surgery from the University of Jordan in Amman, Jordan, and from VCU School of Dentistry. He completed an internship at the Ministry of Health in Amman, Jordan, and externships at Cook County Hospital in Chicago, Illinois. Dr. A is Invisalign-certified provider. He is a member of the American Dental Association, Virginia Dental Association, and Richmond Dental Society. He is fluent in English and Arabic. He sees patients at CMH Family Dental Clinic in South Hill. The practice is supported by a grant from the Virginia Health Care Foundation. So I will turn it over to you, Dr. A.
Right. Good afternoon, everybody. My name is Dr. A. Pleasure meeting you all. And I'd like to first extend my extreme gratitude for granting me the privilege of treating people here down in CMH and the people community in South Hill. Thank you all for tuning in today for the lecture. So today we're talking about how to avoid gum disease, dentures, and root canals. And first, I want to start. It's a very complicated subject, but mainly we've been able to hit three main subjects, which is time, the amount of cleaning, and the frequency. You probably will be able to kind of get a grip and handle over that. But at the beginning, we're going to start by we have to choose the right amount of time. So what is the right amount of time for us to brush our teeth? According to the ADA, it's about twice a day, and 2 minutes each would help in reducing the risk for you getting cavities and periodontal disease. Usually, what is the time that anyone who probably spend it in the chair in a dental exam is about 2 hours per year. That's generally the time that we need to kind of making sure that we keep on checking on stuff and things are underneath control, including gum disease, any cavities, or any other issues that might arise and might be of concern. Usually, the time that each one spend in the chair is around 30 hours per year, and it's 2 hours in taking care of their teeth, brushing or flossing. Considering that amount of time devoted daily for your cleaning, the more time that you spend at home taking care of your teeth, the less likelihood you'll spend that time in the chair taking care of your teeth, in the prospects of making sure that we putting fillings in there, or doing root canals, or taking out teeth, or any other issues that we need to do. So the ADA have identified three main aspects for us to take care of our teeth at home. One of them is general recommendations, is basically whatever the ADA recommends for everybody out there to do. And basically those are brushing and flossing, pretty much. There is the personalized recommendations, which basically could be tailored to people, meaning that some people would have more issues in certain aspects of taking care of their teeth one than the others. And that's where we kind of tailor them out. And by increasing and decreasing those depends on the person. And there is a lifestyle considerations, meaning that smoking, eating certain, diets that have a lot of sugar in them, a lot of carbohydrates, and those will kind of put you at risk of getting more cavities. Moving on to the next one. So the general recommendations: brushing twice a day, just as I said, using a fluoride toothpaste. And when it comes into that subject, any toothpaste could work. Anything that has fluoride in it will basically gonna be doing the job. And no more discrete recommendations. Now for the tooth frequency brushing, usually optimally we look for 2 times a day. 3 times a day is more preferred, but 2 times a day is basically the target that we'll be looking for. And usually using the fluoride toothpaste, according to the scientific data, it has shown that using a fluoride toothpaste have had better results in addressing the cavities and gum disease more than the fluoride non-fluoride containing toothpaste. So for fluoride toothpaste, we're going to be talking about, um, the over-the-counter ones have about between 1,000 to 1,500 ppms, which is the units that we use to measure how much fluoride is in there. And those basically are, um, available for anybody. You could buy it from any, CVS, Walmart, whatever store that you can access toothpaste from. There's other kind of toothpaste that we kind of prescribe, which are the prescription level toothpaste that have a lot of fluoride in them. And those have specific indications to them, specifically meaning if you're currently experiencing a high occurrence of decay or cavities or caries, those kind of help in kind of shifting the balance towards more prevention and helping you kind of, taking care of those, cavities. And according to the scientific data, it has shown that 16% per tooth to 31% per surface, meaning that, there is 16% chance for those people who are using fluoride-containing toothpaste to have less cavities than people who don't. And now, moving on to the other subject, which is toothbrushing duration. So in that regards, generally across the board, it is recommended that you brush your teeth for 2 minutes a day. And those for 2 times a day, so take about 4 minutes per day. And those kind of optimal durations where you'll be able to kind of mechanically remove all the built up plaque or food remnants around your teeth effectively in order for you to have clean surface around your teeth in order for you to prevent having cavities or gum disease. And so now to clean between the teeth, which is the flossing. Of course, flossing is often used as a shorthand for dental cleaning. Usually this is usually problematic because people presume flossing as ineffective or unnecessary, where in fact it goes hand in hand with the brushing and is as equally as important. And it's, of course, it's a technique sensitive thing. So whenever you're doing it, it's about doing it right and you're doing it in the right amount of time. And it's as important as brushing your teeth in order for you to prevent getting cavities or a gum disease. According to the scientific data, or irrigation, or you could use either a tooth floss, the floss, you could use a water pick, any means for you to gain the interdental cleaning would be considered as effective and would probably be able to address the flossing that is needed. There is no best interdental cleaning method. It is just what is preferred. And as long as it works in your hand, it should do the job. And if it's doing the job, meaning that we're doing what we need to do. But mainly we have to make sure that we're doing that regularly, meaning that there is no discontinuation of making sure that you always do your flossing beside the brush in order for you to maintain an optimal oral health. And now we talked about brushing, we talked about flossing, we talked about the toothpaste and how long do we need to brush, how long do we need to floss, and how we need to floss. Now we're going to have to talk about kind of diets that we eat. Usually, effective micronutrients content of the diet, usually if they are containing more sugar, they have been shown to cause more issues in association with getting cavities. But there is no scientific data related more to the periodontal disease as much as the cavities itself. So whenever you're considering anything at home, making sure that whenever you're eating it, you're being actively thinking about the amount of sugar that is in that food, and would help you kind of tailoring making sure that you addressing those right after, meaning the brushing and flossing right after taking anything that would have sugar in it or refined carbohydrates. So, and seeing your dentist regularly obviously help us making sure that if there is anything going on, anything we need to take care of, we try to take care of it right in the early stages before it develops, it becomes more of an issue and a concern and a problem that might cost you more time, more money, or even just this inconvenience of having going back and forth to the dentist to take care of it. So in in the grand scheme of things, the more time that you spend at home taking care of your teeth, it probably will save you a lot of time and money being in a dental chair doing that. Um, and it can be concluded that there is a merit in tailoring a patient recall interval. So basically, whenever we're calling you back in, it depends on the case. Some people would have to come in for 3 months, every 3 months to get a cleaning. Some people have to come in every 4 months, and others have to come in every 6 months. It really depends on your case, and depends on what is the stage of if there is a gum disease, and what is the stage of that, and where is it in control situation wise. And for the personalized recommendations is basically, some people would probably recommend doing them, brushing 3 times a day instead of 2, or making sure that they use, a certain dental floss in a certain way in order for them to be able to take care of the certain spots between their teeth that might be difficult for them to clean it in a regular fashion, just like, the general recommendations are. And personalizing your life's changes in order for you to be able to address those specific, very unique case-tailored situations. The ADA recommendations on antimicrobials basically are, if you're using a mouthwash at home, and does it really help in addressing those issues, like getting gingivitis or getting a gum disease? In fact, the evidence have shown that it actually could help in decreasing those, risk of gingivitis or risk of a gum disease. So in the grand scheme of things, multiple home remedies, the brushing, the flossing, and the toothpaste, and the mouthwash would help in kind of pushing things towards more prevention, instead of you failing in one of the parts in the back, maybe between the teeth or in an accessible area, where it would be really unfortunate for you to get back and get a filling for, or lose a tooth maybe for that. For fluoride mouth rinses, some of the mouth rinses would have antimicrobials in them, and others would have fluoride in them. And these, one of the main ways you can access fluoride, either by a toothpaste or by the mouth rinse, sometimes specific applications with gels, or maybe a varnish in the dental chair in the office. And all of those helping kind of preventing you from getting cavities, or stop active cavities from progressing and becoming more involved inside the tooth. And at that point, you might need a root canal or taking the tooth out. Now, in regards to toothbrushes, the power toothbrushes, and the debate between, is it better than a regular toothbrush, or is the regular toothbrush better than the electric one? And in fact, as long as you're able to use whatever methods effectively in order for you to making sure that all the surfaces around the teeth are clean, both methods should actually work. And I know that each one of them have certain price tag comes into it. As long as you be able to perform that effectively, there should be no difference. Some people would prefer using an electric toothbrush over a manual toothbrush just because of the ease of the use, and because it's more convenient for them to kind of keep track of them, especially with those new ones that have apps who kind of tell you how much time you spend in each site around your teeth and how long have you been brushing your teeth. So people really like having that to help them kind of keeping track of it. And the endodental cleaning devices, as I said before, it ranges between, using a water pick, maybe we're using a regular floss. I personally use a regular tooth floss, and some people use water pick, and whatever works in your hand, it works, it does the job. So that's what we're really looking for at the end of the day. The lifestyle considerations for oral health at home. Some people, some of the commercials would actually try to sell you some do-it-at-home orthodontics, and those basically you're going to have to take a mold of your teeth and then send it over to the company, and the company would send you over a bunch of stuff in order for you to do your Invisalign or your braces at home, in the sense. But usually the ADA recommendations is discouraged regarding those, just because of sometimes the user error could be playing into those and might cause multiple issues. including a poor fit for those that cause, impinging on your gum and or misalignment of your teeth and causing issues in your joint, the TMJ right in here. Those do-it-yourself orthodontia and direct-to-consumer products usually cause a lot of tooth movements that sometimes could affect you negatively, in the sense that if you have a gum disease that is going around, that might be exaggerated in the sense of things could accelerate you losing your teeth because of increasing the pressure on the teeth from the movement and the existing gum disease that is going around. Root resorption is definitely observed in those situations, and using those methods at home might actually accelerate losing the teeth or causing root resorptions and end up losing those teeth. And making sure that you always come in for regular dentist visits. Beside that, like even going to the orthodontist will help in making sure that the treatment is done within a certain time frame, and each single target that it needs to be met within a certain time frame is being met, and all within the safe parameters of the movements. Because sometimes people would have a gum disease going around while doing orthodontic treatment, and at that time, the orthodontist would recommend taking those taking those braces off in order for us to take care of the gum disease that's going around. And sometimes cavities would be happening also while having braces. And having braces in your mouth would cause a lot of challenges per se that might make sure that you might be able to get more cavities than usual. And in that case, usually the orthodontist will take off the braces and making sure that us taking care of the cavities before we proceed forward with the orthodontic treatment. And that will also put more into the hands of the patient, where they need to be taking care of their teeth from the prospects of at home using the interdental brushes beside the regular brush and the floss, and even using the mouth rinses, the fluoride ones and the antimicrobial ones. And so some of those do it at home might be suggesting you using paper clips or rubber bands. Those might cause you harm and have a serious adverse effects, and that's why the ADA passed a resolution discouraging those use at home orthodontics. So in consumption of fluoridated water, the general ADA guidance about that is that fluoride containing water is beneficial to us in the fact that there's multiple ways for us to consume the fluoride and apply it to our teeth. It helps in strengthening the outer surface of the teeth and make it more resistant towards cavities and harm in general, acidic harm in general. And significant increase in primary tooth decay has been noted in a community in Canada after they have discontinued that fluoride from the water, and that continued to have their ripple effect about 2.5 to 3 years post the cessation of the fluoride from the water. So the U.S. Surgeon General at the time have viewed that and suggested that important the community to add the fluoride to the water sources. And in regards to the using of tobacco products, the ADA is generally has long advocated against smoking in general due to the gum health issue situations that will arise from smoking and the enamel staining, discoloration, and the erosion that have been noted, along with the multiple oral cancers that might happen. It has been well established in the literature among dental and even medical colleagues, in that the effects of smoking could have very adverse effects on us as humans, and that including cancer, as well as other oral health and general health concerns. Regarding oral piercings, in general, oral piercings have a lot of consequences, and they might cause a lot of breakage and fractures in teeth, the tooth wear, and also could cause gingival recession, meaning the gum recession that you might see around the teeth. That including also adverse toothbrushing habits, or maybe, you know, some people would just put a pin between their teeth, or, you know, any kind of unusual habits that people might develop in kind of brushing their teeth against some metal parts, or putting nails between their teeth while working, might cause issues between breaking their teeth and gingival recession, besides the dangers of actually having that in. So in summary, what we wanted to talk about is basically that the dentist may tailor your treatment, or may tailor your home care, in that, you know, the brushing and the flossing, and in addition to mouth rinses, addition to fluoride, in both prescription toothpaste and the over-the-counter mouthwash that you can use. And those all would help in, you know, in a dynamic way, kind of pushing towards more prevention to you than keeping you at risk of getting the cavities and the roots decay, the root decay, and the gum disease. And it, in general, it could be personalized to everyone. And sometimes general recommendations could work for most of the people, but in some of the cases, things might be a little bit tailored towards getting more benefit towards you as a person. And of course, generally brushing for about 2 minutes each day, you know, 2 times a day, the flossing, and regarding toothbrush or you know, electric one or a regular one, either could work. Whatever works in your hand works in your hand. And making sure that you always visit your dentist for at least regular cleaning to keep sure that we keep things at check. Either it was a cavity, or as a gum disease, or even an oral cancer that didn't start. So basically making sure that you're healthy and maintained as well. And this is a flyer by the ADA that kind of sums up everything that we talked about today in regard to toothpaste, toothbrush, mouthwashes, and regular recommendations regarding your lifestyle changes. And thank you.
Thank you so much, Dr. A. I appreciate it. I also wanted to welcome Leanne Garza, who's the practice manager. She's on the line if anybody has any questions about the practice, but we will open it now for questions. So you can either unmute your microphone, or you can type something in the chat and we will get your questions answered.
All right. Well, if you have any questions at any time, please feel free to reach out to me. We're always here, happy to help. And again, thank you so much for the opportunity to be able to provide care for the people in Southville and CMH. And it's been an honor and privilege talking to you all today. And thank you so much.
Thank you, Dr. A. We appreciate it. So we have recorded this session and we'll be posting it on our website and also on our Facebook page. If you'd like to make an appointment with Dr. A, you can call 584-5590. Thanks so much. Y'all have a good day.